Hi, and welcome to the second half of your week. I hope it's been going well. I'm going to turn the video over today to public health to talk a little bit more about masks. Masks have been a topic that have been discussed in many different settings over the past number of months. I'm now saying mask even when I try and say different words. Masks have also become a flashpoint at times in a broader conversation around reopening and everything else. We want to strip that away and talk about masks from the perspective of public health, our employees, and the people coming in our doors to serve. We continue to want to use the best guidance we have available in front of us to guide our decision making. We continue to want to make sure you and the people coming in our doors are always safe. And we want to do the best we can to update and be flexible as we acknowledge that our lessons learned about the coronavirus change week over week, and we know that there's more that can be done. One of the things we have learned though, masks matter, and we're going to ask that you be wearing them around the office once we are able to provide them to all employees in the days ahead. Thank you, have a good day, talk to you again soon.
Hi, this is Lynne Ogawa, Medical Director for St. Paul Ramsey County Public Health, and in anticipation of the policy coming out regarding facial coverings / masks in the workplace, I thought now would be a really good time to review best practices around cloth masks, alternative masks. They carry a number of names, but what they are is essentially they are face coverings that are not made for medical personnel, but they are made to help slow the spread of COVID in the community. One of the issues is who should be wearing cloth masks. Anyone over the age of 2, we should do our best to try and wear masks whenever we are in situations where true social distancing, space greater than 6 feet, cannot be met. So the recommendations are in buildings, wearing masks, because at various times we may be able to be 6 feet, but at other times we may not be able to be 6 feet. And so wearing a mask helps prevent the individual wearing the cloth mask from spreading any virus. And that's the big issue, or one of the big points, is that my mask protects you, your mask protects me. And the more that we can protect each other, the better. Masks keep us from spreading the droplets that carry the virus. And so if it's covering our face, then it traps the virus from being spread into the air, onto surfaces, onto our hands, or other things. People who shouldn't wear a mask are clearly anybody under the age of 2, anyone who cannot safely and comfortably wear a mask and breathe, or be able to remove that mask on their own if something were to happen. They should not be wearing a mask. So we should never put a mask on somebody who is not breathing well already, is unconscious, or who cannot remove that mask if they were to have trouble. So when you wear a mask, you want to make sure that first you wash your hands, either with soap and water or an alcohol-based disinfectant. Then you want to take the mask, you want to put it over your face and loop it behind your ears if it's on the side, or over the top of your head, secure it comfortably. And you want to make sure that it covers both your nose and your chin, because the virus can leave through the nose or through the mouth. And so when you do that, you also want to make sure very importantly that you are breathing comfortably. Again, like I mentioned, it should not restrict your breathing. So I'm going to show you now. You want to make sure that it's above, and if you can sort of make sure that it's comfortable around your face. And you also want the sides, they don't have to be tight and constricting, but you want them to be laying down so that not a whole lot of air flows around the mask. Okay? And then after you've worn it, if it gets soiled, visibly dirty, you definitely want to wash it right away. You also want to be washing them regularly after each day, ideally, of use in a standard washing machine. The CDC also has directions on how to hand wash and dry cloth masks that are quite good and require a little bit of bleach, but would work just as well. The important do's and don'ts when wearing a cloth mask. Do make sure that you cover your nose and mouth. Do wear a clean mask always, making sure that you wash them. Do wash your hands before putting the mask on and after taking the mask off. And wash your masks at a high temperature or as directed by the CDC to make sure that you're killing any bacteria or viruses that may be in it. Don't reuse a mask without washing. Don't hang it around your neck or on top of your head. Don't touch your face while you're removing the mask. The other thing that's exceptionally important is that a mask does not take the place of all of the other important parts to stopping and slowing the spread of coronavirus and protecting yourself and your family. A mask does not take the place of washing your hands. In fact, as I said, you still need to wash your hands before and after you put on the mask. You still need to be washing your hands throughout the day as you may be touching high touch areas within your office. A mask does not take the place of wiping things down regularly, and so you still need to be doing that. It does not take the place of maintaining social distancing whenever you can, so that 6 feet bubble that we're getting used to is still exceptionally important. It also does not take the place of, if you become symptomatic, exceptionally important to talk to your doctor or your provider, to get tested, and to stay home from work. Masks are just one of the parts of all of us working to keep the spread of COVID low, keep ourselves and our family healthy, keep our community healthy, and controlling this pandemic. Going to our website or the CDC website will bring you the most up-to-date information. It'll also give you more information around the use of face masks, around the latest data associated with the pandemic, the things that we're learning about the virus on a regular basis. Thanks.